welcome to MDD First Aid. So today we're going to be talking through and demonstrating an adult choke situation. You first need to decide whether it's a full choke or a partial choke. With a partial choke, air can still get in and out of the airway, which means the patient will still be breathing, so possibly making lots of noise, trying to cough to bring the object back out. They tend to be quite flushed in the face as well. If this is the case, let them cough and encourage them to cough to bring the object out. You could also consider warm drinks, which will dilate the esophagus, which may wash it down. You need to monitor this patient, so if anything changes, you can then go into a different type of treatment or obviously get further help. When it's a full blockage, the airway is blocked, which means the patient will not be breathing, so they won't be able to cough to clear it, and they won't be able to talk to tell you they can't breathe. So the first thing you need to do is make sure your patient is standing up. You need to support them with your arm around their chest. You're not taking their weight, it's just support. If they can be leaning forward slightly, that will also help gravity to bring the object out. The first thing we do is 5 back blows between the shoulder blades in the centre of the back with the heel of our hand. It's not just a tap, it needs to be quite hard because we're trying to force the object out and obviously save the patient's life. So we do 5 back blows. 1, check, 2, check, 3, check, 4, check, 5, check. Checking each time just in case the objects come out and we no longer need to give back blows. If that doesn't work, we then bring the patient so they're stood directly in front of us. So there's no space in between you or the patient. You need to clench the fist of your dominant hand with a knuckle sticking out. You place it about an inch above the tummy button with your other hand wrapped around. You then do an in and up action, but it needs to be fast because you're trying to wind the patient to force the object out. So I'm now going to demonstrate how you do an abdominal thrust with the choking vest. You can see from here we've got the tummy button, we've got the cross where the clenched fist will be placed, and then you've got your trachea here, which has got the foreign object in, which I'm putting down into it. Then the idea is I'm going to perform an abdominal thrust and you're going to see the object come out. So you need to be stood behind the patient, so no area between you and them. You need to wrap your dominant hand around so it's sitting on the position just above the tummy button. You then need to wrap your other hand round, have a good stance so you can use all your power, and then it's an in and up thrust. And the object comes out, as you can see from there. When you've done your 5 back blows and your 5 abdominal thrusts, you keep repeating from one to the other until the object comes out and your patient's okay, help arrives, or your patient collapses into an unconscious state. If this is the case, you need to go back to the beginning of your primary survey, which is your initial assessment, which is your DRAB check. Danger, response, airway, breathing. If your patient is breathing, put them in recovery. If they're not breathing, but you haven't managed to get an object out of the airway, then you would just do compressions only. If you have managed to remove an item, but the patient is still not breathing, you're then going to do your normal CPR, which is 30 compressions to 2 mouth-to-mouth ventilations. Thank you for joining us.